Good evening and welcome to Current Affair. My name's Dolbey. Tonight, our special healthcare edition. We've got 3 stories for you today. 1, do vaccines cause autism? The answer may shock you. And the second story tonight will be, do we need antibiotics for viral infections? But first up, we've got a story on birth and pregnancy options. So here's our reporter, Dolbey. Birth, the miracle of life. But how do new mums proceed when given a diagnosis of pregnancy? There's so many questions to be asked and so many things going through their mind. How are they going to get to the hospital? Who's going to be there? What's going to happen during labour? What kind of pain relief are they going to have? How much intervention do they really want? What kind of pregnancy experience do they want? And what kind of outcome do they want from their baby? There's so many questions that need to be answered. So let's ask a few expected mums and experts about which is the best way to proceed for new mothers. So Jen, you're pregnant with your second child, and you told me that you had previously a caesarean section with your first one. So tell me, which mode of delivery have you decided to go for and why?
I think this time I'm really hoping to have a more natural approach because the C-section was quite traumatic. So something like a vaginal birth.
Okay. Do you consider the risks, knowing the risks, how does that make you feel?
I know that there's an increased risk with vaginal birth, but I really want something more natural this time.
Okay.
So Dr. Rob Stetrix is a specialist in deliveries. So Dr. Rob, what are your recommendations regarding elective caesareans?
Look, elective caesareans can be an option for some women who are particularly concerned about childbirth, or when they've had there may be an indication of having a caesarean, such as a previous caesarean section. What we do recommend is that we prefer to go for a normal vaginal birth if that's appropriate, because there are increased risks of with the caesarean sections, which often require a lot of rehabilitation after the birth. One thing that we have seen though is that while in developed countries the Caesar rate has gone up, that hasn't really been associated with any benefit to both mum and bub. So Anna, how has your care planning changed since the birth of your first child?
My birth plan is to have an elective caesarean section at 39 weeks. In my first pregnancy, I had to have a forceps delivery after my baby didn't progress. I'm really scared about having to go under and I'm still unsure what is best. I've been told a lot of different opinions from doctors, midwives and even other mums. I just hope it won't be painful. The last time I went into labour, I nearly squashed my partner's hand in pain.
So Jen, there's plenty of different options in terms of pain relief that you can have during pregnancy, ranging from simple analgesia all the way through to epidurals and opioids like pethidine and things. For your next pregnancy, which pain relief option will you be going for?
I think this time I will want the epidural straight away, but I don't think I want the opioids.
Yeah, why's that?
I don't really know, Liam.
You're currently in the first trimester of your first pregnancy.
Yes.
What care model have you chosen for this pregnancy?
I've chosen to do GP shared care because I would like to get to know my midwives before I have my baby, and because I live in a rural area, so it's a bit hard for me to get to a hospital.
So Dr. Rob Stetrix, for the women out there who choose something more natural, such as water baths, what are your thoughts on this?
Look, when women go into labour, you want to give them options, but so they are more than welcome to have a water birth if they're appropriately supported. So usually when we have women with water births, we get them in the first stage of labour so that they're nice and relaxed, and then for the actual delivery, we deliver them outside of that. There can be problems because we can't monitor the baby when they're having a water birth, and also there's a risk of infections and things like that. In terms of home births, again, the similar sort of thing is it's all about doing it for the right women and the right circumstances. 2, 1. Thanks for our mums and specialists there. Now it's back to you in the studio, Liam. And that's all we have time for. I'm your host, Dolbey. Join us next week for our special report on supermarket dog food prices.